ಇವತ್ತಿನ first lecture we will try to continue with the first topic, that is practical use of certain drugs and toxicological disorders of wild animals. So first of all, I welcome all of you who have applied and come very promptly to this workshop is concerned, because the aim of this particular workshop is to enlighten the knowledge of the veterinarians to some extent in such a way that at least you can handle the wildlife with little more comfort and confidence. That is the main aim, and in this way we have taken the permission of the university to go ahead with the workshop. Of course, 32 people have been deputed, and I think half of them are present, no? Okay, anyway. Bandidara? Illa. Okay. So, coming to the first part of this thing, this lecture is divided into two portions. Number one, the pharmacology of certain drugs. I am not going into the deep of any of the drugs, mechanism of action and everything. Very superficial, which are the drugs need to be used in wildlife when they come for the treatment or a darting or anesthesia, whatever it may be. And secondly, what are all the important toxicities which we encounter in wildlife and also in the cattle, just to upkeep our knowledge, that's all. So, the thing is, various drugs are already developed to treat our, especially the health and well-being of the wild animals, and among the number one drug comes, it's for immobilization always. The disease and other thing we can treat with the routine antibiotics, antimicrobials, antifungals, and many more. And the treatment of injuries and illness is the second main part of the wildlife, and the third is the pain relief of most of the animal is required, because whenever there is a human and animal conflict, then the animal will jump in some well and get injured a lot, and at that time we have to treat them for the pain, and also we have to sedate them, and the sedation and lastly the vaccination program of the wild animals. Of course, once again we have to restrain them, and some of the thing, see, many of the vaccination has to be administered till in India we have to use the injections as vaccine, whereas in other countries they are using the oral vaccines, which especially the rabies oral vaccines have already developed to the greater extent in the countries like Australia and America. Whereas in India cannot afford the high cost of the oral vaccines, especially anti-rabies vaccines, and hence we are still there in the era of injections. Okay, apart from this one, we require the specialized knowledge, especially for handling the animals, because each animal's physiology is different, its stress level is different, and training the people is also very important. The assistants, we should have a trained assistants, or else they will afraid of the animals, and sometimes they may be bitten by the wild animals also. Then we should ourselves should have a good training program to our skills, and there is lot of species variation is there, especially in the wild animals. Unlike the domestic animals, there is a species variation in between the dogs and cats, that's only. Whereas in wild animals we have got the canids, felines, then domestic ruminants, and reptiles, and so many things are there. As Dr. Shridhar was telling, many people bring suddenly a tortoise, and they say that it is not eating some of the food, etc. And some people will bring a squirrel or many more things they will bring, and sometimes they will bring a snake and other things. So the people should have the knowledge of how to anesthetize those animals, what are the minimum diseases they will have, and what are the antibiotics, contraindications, indications, their route, dose, etc. We should minimum knowledge we should have. Then there are lot of legal issues while handling the wild animals, especially. We cannot handle the wild animals as we are handling the domestic animals, because we have to have the permission of the DCF wildlife, and so many authorities are there to control us. Even to conduct a postmortem also, there are lot of protocols are there. And to share with you an incident, we are going, our department of pathology is going with the forest departments only to conduct the postmortem, and they have brought some tissues for histological examination, and after histology they retained those tissues. And suddenly one day the forest squad from Bangalore, they came and they raided the department and seized the samples. So they know, and they were with our officials, and our teachers were very well involved. And they say that you have not taken the permission of taking the samples, even though they need to be discarded. Of course, as per the Wildlife Act, there are stringent protocols are there, but for study purpose also, they are inhibiting such a greater incident. That inhibits us to study a lot, especially in the wildlife. Even then, to fill that gap only, I invited the DC of Wildlife to our institute to have the interaction with the veterinarians. So we are having lot of discussions in between. The monkey fever, everything is emerging, and the veterinary department is not involved. They are only called for the monkey postmortem lastly and discarded. Even though it is very well proven that the animals harbor the ticks, Haemaphysalis spinigera, and they come to the house. So in this aspect, we need to encash that particularly the knowledge base, out base, and to enter their era. And unfortunately, everybody is becoming a wildlife expert. The Ullas Karant, who is not having any veterinary knowledge, and so many people, the NGOs, they are claiming that we are the wildlife experts, and TVs and everywhere, veterinarian is not called for any interviews, etc. And they are taking the opinion of the social workers and so many people. That's an unfortunate thing, and we have to come up with this thing. Even though the university has established the Wildlife Research Institute, it is not being nurtured by the state government. And of course, we are all busy in treating the large animals, and we do not have the time to spare it to the wildlife. Anyway, leaving all that aspects, whereas in the Western country, they have got the helicopters, very specialized darting guns, and also a special vehicle for capturing the animals, the advanced darting equipments, everything they have got. Whereas our vets has to fight with the animal, and sometimes it breaks his neck and head, nobody cares. And you know the recent incidents of Dr. Vinay, how he has suffered. So in this aspect, we have to have the specialization. And the chemical restraint of the wild animals, a drug has to be used to immobilize that, particularly the cattle is, this wildlife is concerned, and they may be walking, running, and aggression. Whenever an animal enters a premises of the human being, there will be a lot of hues and cries. Everybody start focusing. The media come, and there will be a sound of crackers. Everything they start. So the frightened wildlife become very aggressive, and they may attack the veterinarian at any time. So we should take care of ourselves also. Hence, we should know how to use a restraint, chemical restraint, for an aggressive animal to sedate it. And sometimes you are hearing that some of the veterinarians gave the higher dose of the sedative or hypnotizer or tranquilizers, and the animals died. And the forest department, they will always come and stay with us for photograph for whenever there is a success story. But when a failure comes, they will aim at the veterinarian, because they say that overdose is there, and nobody knows whether the animal was excited condition, whether the hepatic failure was there, whether the animal has the kidney failure, or how we can calculate the dose. We have to calculate the dose approximately, whether there was idiosyncrasy for that drug, and whether the reversal agent was available at the time of the operation. Nothing. So they will simply blame us. In this aspect, we have to educate the people and also educate the forest department persons, just like the veterinary legal cases. So chemical restraint is safe, of course, if you use every drug very, very judiciously, because most of the drugs what we are using at present are highly potential drug and potent drug. And if you calculate the dose wrongly, definitely it will end up in the death of the animal, and ultimately the veterinarians are blamed. So why we have to do the restraint? Number one, to allow examination of the animal for maybe a treatment for a injury or to treat the wound. Simply they cannot allow us to treat a wound, simple wound also they cannot allow us to, unless we immobilize them or cage them or whatever it may be. So allows to caught in snares and traps in the wild by poachers. So many times these poachers, they put the snares and they put traps, and many times the tiger, the jackals, etc. get trapped there, and they will get injury. And at that time you have to go them, sedate them, and then treat them. Sometimes there may be a fracture also, then it may need surgery. At that time this is very important. Whereas unlike the domestic animals, all the animals, wild animals, except some animals, are very, very ferocious, and they can take the life of the veterinarian and the attendant at any time. So our life is at risk, and valuable to the wildlife health research and management. For any research, to put a radio collar also, to put a ear tag also, we have to sedate the animal. Without that we cannot do, just like simply putting some ear tag to a cattle or a sheep or some other animal. It's very difficult for them. Whereas the disadvantage of this chemical restraint agents are occasional failure of equipment at the site. None of us are very perfect in darting or calculation of the dose, and it requires the experience of a veterinarian. What may be the weight of the animal approximately you have to calculate. There is no what you call as weighing balance or L into G square, we cannot work on it. So we have to take it approximately. Then there are undesirable side effects, most of the atropine and ketamine, xylazine, all those are acting in a very different manner in different species of the animal. So because the animal is excited already, there may be increased cardiac rate, increased respiration rate, and if you give the drug or dose, sudden there is a chance of syncope of that animal. And improper darting, many times you are aiming the darting at thigh or hip or ramp region, but it will go and struck with the thoracic region where the drug cannot be absorbed at all. So all these are the constraints and improper and cannot be applied for mass capture of the animals within a group. Suppose there are 10 tigers are suddenly they have gushed into the village. You cannot use this particular technique to dart the animals, because one will go in the one direction and other will go in the another direction. So this is the problem. Whereas in the other countries they have got very sophisticated darting equipments, the vehicle for transportation of the injured wild animal, the sedation cages are there, squeeze cages are there, and the chambers anesthesia, the mobile anesthesia chamber is there. The gaseous chamber can also be used. Whereas in our country, the state of chemical restraint may vary from immobilization. Immobilization means restriction of the animal movement for a partial thing. Then to complete tranquilization, it has to make the animal calm. Some of the animals, wild animals, when you go for approach for any administration of the medicines, they become aggressive immediately. And we cannot predict any of the wild animals' behavior. It may look calm and quiet, immediately it may attack. Especially this happens with the foxes, especially the bears. They may attack at any time. Hence, we have to tranquilize the animal, and sometimes we require complete anesthesia whenever the animal has to go for the surgery, etc. So the classification of the drugs has to be made accordingly. Tranquilizers are the drug produce calming effect out of the agent. It will never do any anesthesia or complete loss of the consciousness. Whereas the tranquilizers are used in combination with narcotics. So this is a very good combination, especially in case of wild animals. And sometimes the example is espromazine, very commonly used in most of the wild animals. This is one of the most popular agent. We will see the dose, etc. in future.